My name is Nathaniel Ried, Doctor of Physical Therapy and owner of Ried Physical Therapy. So today I want to talk to you a little bit about some of the more common ankle injuries. So one of the more common ankle injuries is when we're walking down the street and our foot goes inwards and basically turns in. So what happens is when we turn inwards, we overstretch some of these ligaments on the outside. Basketball players do it quite often. They turn their foot in as they're playing basketball. And then another very common injury is plantar fasciitis. So this is your plantar fascia, and what happens is a lot of times people that irritate this area of the foot, they're supposed to have nice smooth heel, midfoot, toe movement of their foot when they walk, and instead they have stiffness and they're walking more like this, and then it irritates this area. So both conditions usually result in very similar impairments. You start with pain, then you get swelling, and then the muscles don't work properly. The muscles tighten up again, further making no movement in those joints. So you still don't get that good smooth motion like you're supposed to have. You can get even pain into the calf. You can get loss of nerve sensation. And then once you have swelling in the foot, people actually start to lose their balance because swelling pushes up against the nerves that are supposed to help you detect where you are in space here. So all the nerves that are in the foot, because of the swelling, aren't working properly. So some people have ankle injuries that then turn into falls. You can fracture your hip, and so it becomes something even more serious than it started off with. So at Ried Physical Therapy, we're a hands-on manual therapy-based clinic. So usually the first thing we do is we have to use techniques to get the swelling out, get the muscles happy, and then the next thing we do is to further get the swelling out. We have some machines that we can use on the exact area that we want for whatever injury we're talking about. And then the next thing we want to do is, once we've got the swelling out of there, we want to then try to align everything the way we want it with our hands-on techniques. Then another thing that works really well is we can use some tape that helps stabilize things. The tape actually can stay on there 3 to 5 days and help stabilize as you're trying to stabilize it with the muscles. The next thing that works really well is dry needling. Dry needling works really well once you got the swelling out of there, and if you still have dysfunction with the muscles, you can put dry needles into that area, and usually most people don't even feel it going in. What it does is it brings blood flow to the muscle, relaxes the muscle, keeps everything aligned, and also brings blood flow for healing to the area as well. So once you've got everything happy and where it's supposed to be, then you want to stabilize using some very gentle techniques. And then also at the very end, you usually want to restore somebody's balance. Most of the time, it's going to need some balance training just to make them safe in their own environment. And then lastly, we are very big on educating the patient, telling the patient exactly how to drive, what kind of braces to use if necessary, what kind of techniques for sleeping, different hands-on techniques to relax muscles. So basically, we've got to get that person to be empowered to keep the progress that they've made in therapy. That way, long term, they'll be able to keep doing what they love to do. Thank you for your time. Have a great day.